Hello and welcome to the Digital Handshake Podcast. I'm your host, Scott Jorgensen, and I'm pleased to be joined today by Dr. Toby Mayer of Beverly Hills, California. Dr. Mayer is a facial plastic surgeon based there in Southern California and has many, many years of experience. I see that you got your scrubs on, probably just stepped out of the operating room. What's that say there on your sort of right shoulder? I can't really read that.
It says changing lives one face at a time. And that's what I've done for the past 50 years.
That's amazing. So your sort of go-to procedure then, I'm talking facelifts, correct?
My go-to procedure are 10 operations that change men, male to female, transgender patients with facial feminization, so the outside matches the inside.
Transgender procedures are obviously, within the realm of plastic surgery, but they're also sort of maybe not as popularized as, say, breast augmentation or eye lifts or liposuction, what have you. So how did you get into, transgender work, if you will?
I had a patient 50 years ago that asked me about what I could do to make her face more feminine, including she was bald, and I did the Mayer flap at the time, and we were able to transfer an entire piece of scalp, not plugs. And from that, she said, "Oh, could you make my voice higher?" And I said, "Well, I think I can do that. I've never tried that before," but she said, "I'm willing to do that." I had an idea of what would work. So I invented each procedure over the next decade, and it's about 10 to 12 procedures that I do to change a male into a female. And you can use those for cis females as well, or males. They're different procedures like rhinoplasty, forehead lifting, etc.
Well, that's fascinating. Let's dive into that just for a minute, because I think this is obviously a new topic for our audience, and I'd love to share a little bit more based on your years of experience. So you had mentioned that there's perhaps 10 to 12 different types of individual procedures that you can perform in your practice that helps transition, if you will, a male patient to a more feminine patient. What are those procedures? And can you share with us sort of like, is there a process to each one of these? Do you build on one after the other? Can you just walk us through this?
Okay, so 50 years ago, there were only two of us doing male to female transgender facial plastic surgery for transgender patients. And his name was Dr. Osterhut, and he and I are the two fathers of this type, because other plastic surgeons did not want those people in their practice. So
Right.
We did everybody for 35 years, and you never heard the words FFS coming out up until about 10, 12 years ago. And Caitlyn Jenner took part of the stigma out, but I do things totally differently than what she had done. My average patient needs, in answer to your question, a forehead lift, supraorbital bone removal, hair, some hair procedure. The Mayer flap is what I use. Rhinoplasty, cheek implants, chin reduction and contour, lip lift, lip augmentation, Adam's apple shave, and the Mayer voice modification procedure.
Wow. So start to finish, for a patient that decides to proceed down this path, how many months or years would be involved here?
Are you sitting down?
I am sitting
do that
down.
in one day.
One day. All of that in one day.
One operation with or without a facelift.
Wow.
So that, my average patient, that's about 6-7 hours. If I add a facelift, it goes up to 8.5 to 9.
Wow, that's fast. And then talk to us about the recovery. So postoperative care, the recovery, for a patient, what would they expect?
Well, it sounds horrendous, doesn't it? So I see
Sounds like
pictures
a
of
lot. Yeah.
patients from all sorts of FFS surgeons from all over the United States and the world, and they look like a train ran over them. I show my patients what my patients look like at 6 days. They can put on makeup, the majority, not the exception, the majority, and go out that night, and no one would ever know they had that surgery 6 days before.
So let me get this straight. So in about 1 week's time, I could go from a man to a woman, and being in a restaurant in the public spaces, for the most part, people are going to see me now as a woman. Is that true?
Yeah. Yes. And she can send you photos of that. You wouldn't believe it. And I have patients who then send me, I don't tell them what to do. Obviously, the best results are transgender patients who go that extra mile like cis females do. Makeup, jewelry, hair, they dye their hair. They do everything a cis female does. But beyond that, you can see how their whole persona changes now that piece has been filled in. The way they stand, the way they hold their cell phone. I don't tell them how to do that. They send me pictures. You look at it and you go, oh, that's a woman.
That is remarkable. That is remarkable. Let's switch gears a little bit, Dr. Mayer. You know, a procedure like this, or procedures, if you will, like these, how would you begin to market these? Because I got to imagine that the audience here is, relatively niched or narrow. And I'm just trying to better understand, as a plastic surgeon, how do you find these patients? How do you market to these patients?
Well, because I've been doing it for 50 years, I'm all about proportion, not making things smaller.
Okay.
It's the proportion. If you destroy the proportion, you've taken a step backward. So, for example, Scott has this bone here. So do females. There's no reason to remove that. Some surgeons do that. They remove that. And all it does is make this look disproportionate and bigger, the opposite of what you want. I never do that operation. So the marketing, the best marketing for me are results. What do other people do? They're far more savvy than I'm an old kind of plastic surgeon. Results, results, results.
Yeah.
They do, you name it, every imaginable kind of marketing. And I tell patients that's fine. If they have the results behind it, I'm all for it.
So share with us, how are you putting your results out there so that, for example, if I'm a patient in North Carolina or Massachusetts, how do I find Dr. Mayer in Beverly Hills?
Word of mouth. And that's the primary way. Everybody knows me because for 50 years, I do Instagram, Real Self, Google. That's how they find me. And then what I'm told, your results are better than everybody else's.
Right.
So whether they are or not, those are the kind of patients I want to do. If someone tells me, I saw Dr. Jones and, his noses look pretty good to me. I said, you should go to him. If you like them more than, I only want people that are going to appreciate what I do. I don't have to work.
Yeah.
And I've been doing this for 50 years, so it holds a special place in my heart. 6 days after surgery, with tears coming down their face, they say, I can't thank you enough. You've changed my life forever. I'll never forget you. I get more than I give.
That's amazing. And I can feel the passion here on the podcast, being here with you. With that is, I want to better understand this concept of how patients can find you in particular, because again, transgender surgery, I'm not going to, it's very niche. It's very niche, right? So there's probably, like you mentioned, when you started, there was only 2 plastic surgeons in the entire country that were even performing these procedures. How many plastic surgeons do you believe today are embarking on transgender work?
There's no certification for male to female transgender FFS, none. So anybody can say, oh, I do transgender.
Right.
And they could be a general surgeon. They could be a plastic surgeon, facial plastic surgeon. They can say that. So, and they market it that way. And that's part of the rub, is that there's no certification. I went to both UCLA and USC and said, we should start something for this. And neither ones were interested. Too small of a group.
Yeah. Yeah. But how many patients would you say that you operate on with this particular procedure per year? Because I'm just trying to better understand is how large or small is this market?
Well, for me, because I've been at it, and I would say I do probably 75 to 100 patients a year, because I do usually one long day, which could be, anywhere between, let's say, 7 hours and 9 hours. And then I do another short day, and then I go play polo.
I love that. I want to spend a little bit of time talking about sort of trends that you're seeing within this specialty of transgender plastic surgery, because I got to imagine things have evolved over the past 40, 50 years that you've been performing these procedures. Speak to us a little bit about sort of the trends that you're seeing today and where you see this specific sort of subsegment of plastic surgery heading.
Well, all of the individual components, some of them have been around forever. Yeah. Facelifting, right? So that's been around. Rhinoplasty, that's been around. Forehead lifting. When I started, there's one guy in Mexico that did forehead lifting, and I was routinely criticized, but I invented a way to do it without leaving a scar. So that's the easiest procedures that I teach. And if I were to show you the results from that I see that are beyond bad, you would cringe.
Yeah.
So just because somebody calls themselves and they think they can do this at the hairline, but if they leave a scar 1/4 of an inch wide, so they're getting better, but it still would be even better yet.
So our mission here on the Digital Handshake Podcast is, helping plastic surgeons make that first digital impression their strongest asset. And what we have found is that, in order to stay competitive, to thrive in today's plastic surgery marketplace, you have to be doing a lot of things right from a marketing standpoint. And my understanding from our conversation today is that, obviously you've had the benefit of being one of the early innovators of transgender facial plastic surgery. Within that is for younger plastic surgeons looking to perhaps embrace this segment of plastic surgery, being transgender, different transgender procedures. What would you suggest? Is there any sort of words of wisdom that you would share with them?
They need to do the same preparation for this that they would do for reconstructive surgery. You need to have, the more tools you have in your tool bag, the better you will do.
Right.
You won't approach everything with a hammer. So if they can find somebody in their area and watch them do surgery at a high level, in the concept, it's getting the concept down. When Osterhut, for example, did this, he would take off this, he would do this, take off the bone, go put it back on. Several things that you don't really need to do that way. And it's little by little, but now they can market. And marketing, they know more about marketing than I do. But if they have good results, they'll succeed.
Very good. And kind of just to wrap up our conversation today, I wanted to just pose the question, because I think it may be on the mind of many in our audience, is when a patient comes in for a consultation and they've expressed interest in, one or perhaps many of these various sort of transitioning procedures that you perform, what steps do you take at your practice psychologically to ensure that the patient is, making the right decision for them in pursuing these procedures?
Most transgender patients have known since they were a kid that they're transgender. It chooses them. They don't choose it. No one would choose this. It chooses them. But you brought up a very, very good point. I just came back from lecturing about this to other plastic surgeons with one key word in approaching transgender patients as well as all patients, a lost art: empathy. Empathy. I cannot stress it enough. Empathetic surgeons. Don't kick it off to a nurse. You can't do that. Touch patients in a nice way. You have to get in touch with their feeling state. And I've been able to do that just the way I am. And it wasn't always that way. But that's why I came back and lectured on it. And when you lecture on it, you say, how many doctors in the room have learned empathy in medical school? One person might raise their hand. So what happens in real practice? They think they're technicians and they punt it off to the nurse because she's often a female and has empathy.
Yes.
Yeah. But if the surgeon can do it, it's as important as a surgical skill set for the patient to feel bonded to you. And they'll be bonded to me forever. And I get more than I give.
Could not agree with you more. And I think that's a great final thought to wrap up our podcast with, is we need more empathetic surgeons that are willing to invest the time in the consult prior to the procedure, not feeling like it's an assembly line, but truly showing that they care, that they have that empathetic passion and love for the patient. I can feel it from you just as you're talking about it. So, Dr. Mayer, it's been a pleasure to have you today on the Digital Handshake Podcast. I want to thank our sponsors, Media PSC, for making this possible, and we'll see you on our next episode.